2020, everybody. This is Fridays with Feldman. Just to discuss some orthopedic issues and some complex orthopedic issues, some pediatric orthopedic, some adult orthopedic problems. So we begin 2020 really discussing a general concept or a general problem that many people have of all ages. Hip problems exist in children, and they go through adolescence, and they can occur in young adulthood, they can occur in athletes, they can occur in sedentary people. So we will discuss, pretty quickly go through some of the problems that people have in their hip and try to understand and how they're treated and when you use one treatment versus another. So the hip is a ball and socket joint. I was going to bring a model, but I couldn't find my model for just today, so we'll do it with just my hands. And basically, my fist is the ball, and the cupping of my hand is the acetabulum, the cup of the hip. And these two have to articulate like a ball and socket. And many times, the muscles attaching to these joints attach in various locations. Normally, they attach onto the outside in what's called the greater trochanter. That's called the gluteus medius muscle. That's over here on the hip, on your side. And they can attach in your groin onto the lesser trochanter, which is your hip flexors. So there's muscles that move your hip in, they move it up, they move it out, they flex it, they extend it, they abduct it, which means they move it out and they move it in. And all of those muscles can become injured. So that's the first thing that anybody can have. So when a child has that injury, or a young adolescent has that injury causes pain, the most common problem, and they can actually rip off the bone from the pelvis or from the hip. And that's usually a hip flexor, and they can rip that off. And the treatment of that is usually just anti-inflammatory medications, some crutches, some physical therapy in time, and the patient will get better. And then really a training program or a stretching program, because stretching will provide a real support for these muscles to be able to lengthen without tearing. And so in everything that we're going to talk about, certainly stretching after you've warmed up is crucial for the muscle injuries. And that's what some people want to know about. Let's say runners, for instance, who get tendinopathies. They get injuries to both their flexor tendons and their abductor muscles as they attach onto the trochanter. And most of the time, someone who's a runner should warm up first, do a great deal of stretching. But then let's say you have these injuries. Let's say you have a chronic injury to, let's say, your greater trochanter, the bone on the outside of your thigh. Well, sometimes we give injections for that. There's different type of injections. If it's just inflamed, you can give a steroid injection. If it's torn, you can sometimes use plasma-rich protein, which is called a PRP injection. Either through a minimally invasive approach to fix the tendon that has been injured. So again, tendon injuries or muscle injuries are often treated conservatively without surgery, but at times they do need surgery for repair onto them or injections of certain type for problems. Okay, now what about other problems in hip that people find that they have during adulthood? Well, there's obviously advanced hip arthritis. The joint is degraded. It no longer is a smooth surface, and those have hip replacements. Something that I don't do, but my partners do. And basically, you can replace that with metal and plastic, and the hip starts and functions quite well. I try to take patients who are young adults and avoid that surgery at times, and you can do that. And someone asked me about what's an osteotomy? Well, that's when you break the bone and you realign it so the socket now is more, either the socket is deeper, so that means you do an acetabular osteotomy, like a periacetabular osteotomy. Shallow, so there's no longer point loading, and the patient then can have a delay in their hip replacement, or may never bone or for the hip may do that. What about a femoral osteotomy? Breaking the femur bone to allow it to sit deeper. You can do that too if the bone is not rotated correctly or if it's not angled correctly. Sometimes we reserve that for younger patients. In adults, sometimes that is not always compensated for well, and there may be a limp after, so we try to avoid that at times. Can you have a hip replacement after an osteotomy? You certainly can, if you need it. You could have one more easily after an acetabular osteotomy, but you can have a hip replacement even after a femoral osteotomy. So I think that covers sort of what hip dysplasia means, which is a shallow hip, and we deepen the socket. You can have a muscle injury, and we can treat the muscle injury. So what about the in-between things? And I'm not going to discuss some of the specific conditions that occur in childhood because I think those could be spoke about specifically, like Perthes disease or avascular necrosis, slip capital femoral epiphysis. We can discuss those individually, but there are injuries that people get. For instance, if you're a golfer, and I live in West Palm Beach, so there's a lot of golfers here, you can tear your labrum. Well, what does that mean? So the labrum is the lining of the hip joint, and the ball sits in the joint, but it has these bumpers to prevent it from just hitting cartilage on cartilage, and that's called the labrum. It's quite important. There are surgeons who specifically treat labrums. They do a lot of hip arthroscopy. They sometimes fix the labrum, or sometimes actually replace it with a tendon so that it's reconstructed. So a labrum can be reconstructed if you don't have arthritis. A labrum should not be reconstructed. You shouldn't have hip arthroscopy if there's already advanced arthritis to the joint. That will do nothing. So that's where it comes in. So if it's an acute injury and someone's playing golf and they twist hard and they get a labral tear, that could be completely treated with arthroscopy. Or if they have something called impingement and they bang that hip, and it's just because of the way their hip is shaped, it can be reshaped if they're young and don't have a great deal of arthritis. Even if they're older and don't have a great deal of arthritis, it can be treated that way. So what can someone, and that's the way, and that's treated with arthroscopies. Well, I do many osteotomies to fix this. I allow the sports medicine guys and the sports medicine physicians to do their role, play their role in treating the labrums arthroscopically. Well, what about in between? Let's say you have mild arthritis or mild to moderate arthritis, not ready for a hip replacement, but you want to have relief of your pain. What can one do? So there are many types of injections, and that's where it becomes confusing. Many times these injections are not covered by your insurance company, and because they're mostly experimental, but they're quite effective at times. And we'll go through some of those injections because a majority of people in their 40s, 50s, and 60s do not want hip replacements yet. Their life is not bad enough, it's not impacted enough to warrant getting the hip replacement. They want some pain relief to be more functional. And that's where injections come about. So what about the most common for use for the last 30 to 40 years is a steroid injection. And that injection should be done, can be done to decrease inflammation. Done too often, it can both injure the joint and can cause an infection. So it's not something that you want to do too often, and probably just one steroid injection to decrease the inflammation is okay. Things you read about in the newspapers and are something called PRP. This is when you spin down their blood and you take the stem cells or you take the plasma-rich protein, you inject it in there. And I'm not a big fan of that for joints. I am a fan of that for tendon injuries. I don't think it does very much in the joint. There is a new type of injection out there which people are doing, which I do quite often, and it's called alpha-2 macroglobulin. And that is a medication that basically takes an enzyme that's creating the arthritis and basically neuters it. It just basically stops that enzyme from eating up the cartilage, and therefore probably delays the arthritis that you're having or that one is having, and maybe delay the need for hip replacement. One common question I get is, well, when do I know I need a hip replacement? That is not up to the physician. That's not up to the surgeon. That's up to the patient. It's up to you. And the reason for that is because it's never too late to have a hip replacement. You can't have too much arthritis and therefore it cannot be done. It's really a quality of life issue. I see x-rays on patients and I tell them you have advanced arthritis and they say, well, I have no pain. Well, then don't have a hip replacement. And I see some patients who have mild arthritis and they can't live with that pain and therefore they probably should have a hip replacement at that point. So I think there's many things you can do in between. There's all these salvage procedures that I do to try to prevent it for many years of hip replacements. There are hip replacements and there are the injections. What about taking all these medications for it? Well, certainly taking narcotics, as you know from the epidemic in this country, is a bad idea. So I don't think taking narcotics for hip pain is wise at all. And therefore, if someone's prescribing your oxycodone for hip pain, that's a mistake. What about anti-inflammatory medications like Motrin, Aleve? Those are, that's ibuprofen, naproxen. those are good on short term. All of those are good on short term. The problem with long-term impact of all these anti-inflammatories is they have an effect on some system of yours, whether it's your renal function, meaning your kidneys. They can impact the liver, some of them. And so you don't want to be overtaking anti-inflammatory medications for many years. And if you are taking it for a prolonged period, then your internist needs to be checking you for complications from taking anti-inflammatory medications, checking your kidney function, checking your liver function, and making sure that they're not doing harm to you. Okay, I know I said a lot because I just wanted to give a brief overview. I think there's ways of salvaging hips that are not arthritic but are having pain and shallow, whether it's arthroscopy or osteotomies. Hip replacements are good, and before that there are some new injections I think that can really make a difference in prolonging or delaying the need for that replacement. And once again, talking about some of the muscle injuries, stretching and fitness is the key, but those injuries can be treated again from a spectrum of just physical therapy to injection to repair both open and minimally invasive. So that's the hip, guys. It's a pretty complicated joint. It has a lot of injuries for a lot of ages, but I think that taken in for each individual patient, for each individual need, it really can be rewarding for the patient to have no longer suffer this prolonged agony of having hip pain that hurts when they sit, hurts when they stand, and hurts when people walk. So have a great weekend. Hopefully 2020 will be terrific. I will answer any questions before I sign off. And I think Michaela may have a couple for me, so I'll have her ask me the questions.
Can you discuss labrum tears and hip tendinopathy in adult runners, effective treatments, and how to decide when it's time to have surgery?
Okay, so I'm not sure if you heard that, but again, the question was about, and I got to this somewhat, the question is about tendinopathies and labral tears. Those are two different things. A labral tear, so again, labral tear should be divided into two. It should be divided into, you have it because you have a normal hip anatomy, but you had an injury. I'm sorry, in that case, you should have either a timed PRP injection for repair of it, or an arthroscopic repair of that labrum with an experienced hip arthroscopist. Tendinopathy means it is basically an inflammation of your tendon or a tendinitis. Tendinopathy means there's a partial tear. Again, you try an injection like a PRP, and last case resort is it gets repaired. The bigger question about labral tears is what happens if you have a labral tear, but also a shallow hip on the x-ray? Then don't have your labrum repaired without also having the shallowness treated. Otherwise, it's just going to tear again. So for the athlete, for the runner, for the golfer who has a labral tear, certainly it can be treated both perhaps with injection and rest, and then last resort with arthroscopic management. Okay, so I will sign off now. Have a great weekend and a happy 2020 to all. Take care. See you soon.